I'm very grateful for the opportunity to make this presentation. The title is Effect of Changing Body Position Using a Tilted Table on Pelvic Floor Muscle Elevation. There is no conflict of interest. This research was priority allocation of research funds from Faculty of Health Sciences, Tokyo Metropolitan University. Hypothesis and aim of the study. Determining the sense of the exercise being performed during training of the pelvic floor muscles (PFM) is difficult because it is challenging to understand visually and it is not accompanied by any joint movement. The training limb position is considered one of the most essential factors in PFM training. Therefore, this study aimed to clarify the relationship between posture and PFM. We examined the effect of transition from the supine position to the upright position on the PFM and determined the angle at which the PFM are likely to contract. Study design, materials, and methods. Participants. The participants were 20 healthy young women. The mean and standard deviation of age, height, weight, and body mass index of the participants were on the slide. None of the participants had history of orthopedic, gynecological, or urological disease in the pelvic girdle and lumbar region. How to measure images. Pelvic floor elevation, length of the pelvic floor shifted separate from rest, descent, length of the pelvic floor shifted caudal from rest, and the distance from the abdominal wall to the bladder floor to capture changes in bladder shape were measured using an ultrasound system with a 3.5 MHz convex probe. Measurement conditions. 1. The length from the abdominal wall to the bladder base was measured when the tilted angle was changed from supine to upright position at 10-degree intervals from 0 degree to 70 degrees on the tilted table. 2. The displacement of the bladder floor was measured when the PFM were voluntarily contracted at inclination angles and the same conditions as in number 1. Results. Changes in the position of the pelvic floor according to the angle of inclination. The distance from the abdominal wall to the bladder base increased caudally with increasing tilted angle. However, there was no significant difference in the corresponding increase in urine volume in the bladder over time. Results. Pelvic floor elevation rate and standing tilted angle during voluntary contraction of PFM. Analysis of variance by repeated measurement was conducted for the angle and pelvic floor elevation rate. There was a significant difference in the pelvic floor elevation rate between the angles, and the two-key multiple comparison at a level of significance of 5% showed a significant difference between 0 degree and 20 degrees. Interpretation of results. The length of the bladder from the abdominal wall to the bladder base increased when the tilted angle from the supine position to the standing position was changed from 0 degree to 70 degrees, indicating that bladder was determined caudally by gravity. The pelvic floor elevation rate was significantly higher when the standing tilted angle was 20 degrees than when it was 0 degrees. This is because the pressure exerted by the pelvic organ on the pelvic floor was greater in the standing position than in the supine position, and the length tension curve suggests that the pelvic floor became extended to exert muscle tension. It is thought that the optimal amount of the load was at an inclination angle of approximately 20 degrees. Conclusion. It is thought that if the contraction sensation of PFM cannot be perceived, It is better to start PFM training after confirmation of the contraction sensation in a limb position with an inclination of approximately 20 degrees, rather than in the dorsal supine position. Thank you very much for your attention.